at the right time. So getting back to this case, this is a abdominal CT scan. We're looking for pancreatitis. So there is clearly a steatotic liver right here. That is fat infiltration. It's moderate because I can readily tell. It's hypoattenuating if compared to the spleen. And I know you guys have seen this. There is fat stranding right there. Settle down. We are getting there. Settle down. 46 compared to 55. So we have moderate liver steatosis, and indeed we have no contrast enhancement in this case. This is just an NPR. Real men do axial. Children need NPR. Just remember that. I'm just doing this because you guys enjoy it. No need to do NPR on the CT scan of the abdomen. I'm a grown man. I'm not a child. So let's just write down the steatosis right there. That is moderate hypoattenuation of the liver parenchyma. Let's continue our scroll from top to bottom. The gallbladder is closed, it's contracted, it's shut because this patient has eaten on the last 8 hours, or he has an acute diffuse hepatitis, which can cause this kind of presentation of the gallbladder. So I'm just going to say that on the report that it's closed, it's shut, it's a shut gallbladder, and clearly we can see that is diffuse enlargement, enlargement and fat stranding, enlargement of the pancreas, especially the body and the tail, with fat stranding of the peripancreatic fat, and I can't see any fluid collections, no fluid collections. In this setting, it should be a they call it ill-defined fluid collections. We can say anything about necrosis because we would have to have a contrast enhanced phase and compare, and we would need at least 48 to 72 hours of pancreatitis to be able to properly tell if there is any sites of necrosis, which makes a pancreatitis much severe than a regular one. So there is some thickening of the walls of the transverse colon. This is a common complication because the colon is right there. There is also some fluid right here, free fluid, and it collects right there on the pelvis. So we have a minor ascites. Is it ascites or ascites? I never remember. I guess it's ascites, which is free fluid inside the peritoneal cavity. Prostate and seminal vesicles are fine. The urinary bladder are fine. No lymph node enlargement, no kidney stones. Kidneys are kind of lobulated, but this could be just a normal variant. The kidneys could be just like that. This is a minor complication right there. See, no need for the NPR. We are grown men. This is a minor complication of a pancreatitis. The tail inflammation reaches the colon, so it hurts. Nothing major. But indeed, this patient has acute pancreatitis. Can we tell why this patient has acute pancreatitis? No, we cannot, because most of the times it's caused by alcohol abuse. We have to ask the patient if he has been abusing alcohol, or it could be due to gallbladder stones, but most gallbladder stones are micro stones and they are readily invisible on CT scans. So if you are looking for gallbladder disease stones in a CT scan, no matter if it's enhanced or non-enhanced, you are wrong. Don't do it, because you won't get much in about 70% of the cases. So we have steatosis. We can see this patient is obese, and he has an complicated acute pancreatitis. So let's report that and be on our way, because we have another bunch of CT scans to deliver.